Section 4. Safeguards and Precautions. Standard precautions provide rules for handling all blood and body fluids in a manner that minimizes exposure risk. Standard precautions means treating blood, all body fluids, excretions and secretions except sweat, plus non-intact skin and mucous membranes as though infectious. In other words, if you don't know, protect yourself. Safeguards to protect you. There are certain safeguards that can be used to protect you, such as engineering controls, personal protective equipment or PPE, work practice controls, hand washing, and housekeeping. None of these can protect you 100%, but together they form an effective barrier against infection. Engineering controls are controls such as sharps disposal containers, self-sheathing needles, and safer medical devices that isolate or remove the bloodborne pathogens hazard from the workplace. Engineering controls are your first line of protection. They are built into the workplace environment to protect you. Engineering controls only protect you if you use them and use them correctly. Personal protective equipment is specialized clothing or equipment worn for protection against a hazard. PPE must be appropriate for the task you are doing. You only need to wear as much equipment as necessary. There's no need to look like a spaceman when all you really need are gloves. Types of PPE. Gloves. Wear gloves if you anticipate exposure to your hands. Eye protection and a mask should be worn together to protect you from splatters to the eyes or mouth. Gown should be worn if you anticipate exposure of your clothing or skin. Personal protective equipment rules to remember. Make sure PPE fits properly, especially gloves. Always check PPE for defects or tears before using. Remove personal protective equipment before leaving a contaminated area. Do not reuse disposable equipment. Place used PPE in a designated receptacle for disposal, laundering, or processing. Work practice controls. Work practice controls reduce the likelihood of exposure by altering the manner in which a task is performed. Work practice controls are those things you practice as you go about your work tasks that protect you from infectious disease. Examples of work practice controls are hand washing, practicing good hygiene, handling sharps with care, and no eating or drinking in an area where exposure may occur. Hand washing. Wash your hands every time you remove your gloves, after contact with blood, body fluids, secretions, or excretions, and between all patients, clients, or customers. How to hand wash. Cold or hot? You need warm water. Warm water is more comfortable and more likely to make you wash more often. Hot water is not hot enough to kill germs, as some people think. If it was, it would burn your skin. What kind of soap? Use a non-abrasive soap. Antibacterial is not necessary, but it's okay if you want to use it. Bubbles and more bubbles. Work up a good lather, being sure you wash 1 to 2 inches up your wrist and under rings and fingernails. The bubbles will carry away the bacteria and viruses. Rinse. Hold hands downward, allowing water to drip from the fingertips. Rinse completely. Dry. Use a clean paper towel. Discard it, then turn faucet off using a clean, dry paper towel. What's the dirtiest area in the bathroom? Faucet handles. What were all those people doing before they turned the water on? There are 3 types of transmission-based precautions: airborne precautions, droplet precautions, and contact precautions. Transmission-based precautions are used when standard precautions are no longer adequate. These precautions are not needed for people with bloodborne viruses such as HIV, HBV, or HCV, unless there is also a complication such as tuberculosis. When airborne precautions are necessary, use the following: an N95 respirator, a negative air pressure room with the doors closed, hand washing before entering and leaving the room. Utilize droplet precautions by doing the following: a private room with the doors open, a surgical mask within 3 feet of the patient or client, hand washing before entering and leaving the room, gloves and gown. When contact precautions are necessary, utilize the following: a private room is recommended, a gown at all times, hand washing before entering and leaving the room.